Ranjana, pleasure to be part of WAS. Been there with WAS since its inception, and to stand here now to speak about the importance of short-term fellowships, especially as the concluding remark from Ranjana, and the video was about 3-month duration short fellowships that WAS wants to be making a foray into. Let me just quickly talk about the different aspects of a short term fellowship. I can't really call it a fellowship, I would just call it an observership, because since ours is a predominantly a surgical based fellowship, it's rather difficult to imbibe those skills within a 3-month period. If you're opting for a medical observership, yes, it does help, because in 3 months you will pick up the nuances, but surgical, considering that I work in the VR department, in 3 months it's next to impossible if you are a fresher right out of your post graduation. But of course, if you've already done and you just want to get back into the hang of it, maybe yes, but still VR is tough. I do know short term cataract fellowships and even laser fellowships that are quite helpful. Refractive again I think should work, but it depends. Like plasty, you may not be able to see all of it in the first 3 months itself. So surgical fellowships, like for example in our center we do have a simulator. It's called the VR Magic. So in those simulators, it helps in the sense that you're able to grade yourself and score yourself. After every step of the surgery, the AI will tell you whether you did a good job, how was your tissue handling, how was your speed of operating. Like our fellows go and do ILM peels, they do vitrectomy, they do lasers. And it's a lot of skill enhancement with the VR Magic or the simulator, because it teaches you ambidextrosity, so you can use both your hands to do it. It also grades you in terms of stability. It gives you a zigzag pattern and you have to pass a loop through that. So it helps you, get control of your stability as well. So I'm just going to speak now briefly about a fellowship that I did. It is called a fellowship, and hence I will speak about it. But to tell you, like I mentioned, that wasn't my first fellowship. I finished a full-time 2-year fellowship at Aditya Jyot Eye Hospital for my VR under Dr. Natarajan. And then I took a maternity break, which is okay to take. And then I took another 1.5-year fellowship just to come back into the field again. I didn't want to straight away join, because I had taken almost a 3 or 4 year break, and I didn't want to do a surgical specialty without getting back into it. So I did a fellowship at the same place that I had done my UG and PG, so it felt good to be back. And it also helped me hone my skills there, because during a fellowship you always have the cover of a consultant helping you out, and only after that I joined Narayan Nethralaya. And in fact, during my stint at Narayan Nethralaya is when I went in for an ICO fellowship. So that is what I want to elaborate a little bit on and how it helped me. And even though I went in for an ICO fellowship at the Doheny Eye Institute and UCLA, I frankly didn't go for clinical work. I did have the advantage of doing a little bit of clinical work with Dr. Sadda up there. He is basically a medical retina specialist and one of the most successful medical retina specialists there is, in the field. He is a pioneer in a lot of trials, and also right now he is doing a lot of work in AI. So I basically went to his center for 3 months to learn a little bit more about imaging, because as you know, right now imaging is like the most important thing for ophthalmologists, right from our diagnosis to our monitoring and to AI based diagnostics. It's really big. So these were some of my colleagues there who were also doing fellowship. In fact, the boy next to me is just post MBBS. He came in to work there for 6 months to a year just to understand it more, so that he can decide on which branch he wants to go for in ophthalmology also. So these were the other research fellows, and I must tell you, half of them standing there are not even ophthalmologists. A lot of them are just science graduates, and some of them are even optometrists. So that there's that much of amount of work that can be done even for non-ophthalmologists. So I think for us there are no limits. So why I went there was to be part of something called as a reading center. If all of you all are aware, reading center is basically part of clinical trials, wherein suppose you're looking at a drug effect and you want to read the OCTs, it has to go to a certified reading center. So here they have reading center protocols for fundus photos, FAs, STOCTs, gonios, the works. So if you are going to conduct a trial, a multi-center trial or a drug trial, all the images that you process will be sent to a reading center, where they will be objectively read, graded and sent back to you to see the response to treatment. So they can also be disease specific with respect to vascular, it could be AMD, a lot of work on GA and CNVs are going on, glaucoma also, and of course macular edema. So like I said, we had science graduates, we had recorded lectures, we had ophthalmic books, training manuals, and then at the end of 3 months I did get my ICO fellowship. But I did more than that. I learned a lot about imaging. I learned a lot about the practices in the US because how they treat retinal diseases is completely different. For example, in the 3 months that I was there, I don't remember Dr. Sadda advising laser for one patient, whether it was diabetic retinopathy or vein occlusions. They hardly ever do lasers. Forget PRPs, focals, nothing. All of it is anti-VEGF based treatment. And second thing is it is the paramedical staff who give injections in the clinic, in the OPD. Of course, the difference is that our ambient atmosphere is not as clean as it is there. So they just walk in, they get the injection and they go back driving. So it's that different from what we practice here. So these are the 3-month fellowships that are available on ICO. It's given twice a year with application deadlines of March 31st and September 30th. If you have done your ICO exams, the basic, advanced and clinical before, your chances are higher. But I do know people who have managed to get this ICO fellowship even without prior doing the ICO exams. It is called as FICO, the fellowship of the ICO. I have just listed out the retina fellowships, but there are a whole lot of others. They are all 3-month fellowships. You have for glaucoma, you have multiple of them. And they do give some amount of funding. So it does help you for that 3 month of travel and stay. It is a different experience, and I think the cutoff age is 40. So any of you are lesser than that must give it a try. And what more can you do during the 3 months is that I also managed to go to Bascom Pharma and learn a little bit more about some newer imaging modalities. So making the most of even that 3 months, because it's not next door, you can't keep going again and again, and so you might as well maximize it. So this was at Bascom Pharma. And I also got to present papers on an international forum, and so this was in 2015. So you get these tags like first time attendee and moderator and communicator. So these are some really things that you can do that you can't do here, sitting at one place. So you must take a chance, apply and get it, and that's about it. Yes, these are just personal moments. When you go there, you might as well see the place, visit and see what's different there. And these are some things you all may want to capture, because these are all the resources for all fellowships and definitely for short term fellowships. This is on eOfta, this is on our VRSF website. iLearn also has a couple of resources, and YoTimes. All these 4 websites, you'll get a lot of information about these short term fellowships. Thank you so much.